just presenting her with the Rockstar Award and the Lifetime Achievement and Women Making History Award. Mayor Daniela was elected Miami-Dade County's first ever woman mayor in November 2020. But how about another week? She entered the mayor's office following a 40-year career as a relentless advocate for South Florida families. As Miami-Dade County's mayor, she oversees a metropolitan government with more than 28,000 employees, serving nearly 3 million residents and managing an annual budget of approximately $9 billion. Since taking office, she has worked to protect lives and livelihoods by deploying a countywide operation to distribute vaccines efficiently and equitably, and appointing the county's first chief medical officer to build a pandemic response driven by data and science. In collaboration with the Board of County Commissioners, she is working to distribute millions of federal dollars in American Rescue Plan relief funds to support small businesses and residents impacted by the pandemic, invest in critical infrastructure projects, and kickstart long-term recovery. Her administration is focused on building a stronger, more inclusive, more resilient Miami-Dade, prioritizing reforms to make our county safer and prevent gun violence through the Peace and Prosperity Plan, restoring and reinvigorating a thriving economy that delivers economic security for Miami-Dade businesses and families, and attracts new industries, saving Biscayne Bay and building and protecting our environment, opening doors to prosperity for more Miami-Dade families through the Office of Equity and Inclusion, and directly engaging with residents to make local government more responsive and accountable. And can I just say, ladies and gentlemen, having met her personally, she leads with all her heart and all her dedication. How about a round of applause?
Thank you very much for the recognition and for the honor. I came to honor you. I came because two wonderful women have done so much for this cause and to lift up those who are affected by breast cancer. And they are on book number 3. They're on book number 3. And the inspiration and the enthusiasm is just beaming all around the room, and from the people who are here today, from the authors who put together chapters, from the people who are here who are in treatment now, those who are survivors, bosom buddies. I just learned about that group. Oh my gosh, congratulations. I am really so touched and moved to be part of today's special events. And the excitement, you know, has been going on for many months leading up for today. It has. It's been going up for many months. And unfortunately, that was many months ago, and my schedule changes, and so I'll be running off to the airport in a minute. And you don't have to feel too sorry for me. I am going to Italy. But it's really not to fun and frolic. It's a trade mission. I've never been on one of those, so we'll see how it goes. But really, to have the opportunity to just spend a few minutes with you and say a few words of thanks and hope. This is a day about hope. And, you know, all month long, we're focusing on cancer awareness. At County Hall on Tuesday, I even had pink hair. I was really excited about that. That was very cool. And, you know, in Miami-Dade County government, we're very, very involved in breast cancer awareness and fundraising. So it's something that we have 2 members of the Board of County Commissioners, 2 women who are breast cancer survivors, Commissioner Sally Heyman and Commissioner Rebecca Sosa. And every single year they lead, and we're all wearing pink, and real men are wearing pink, and you know, pink is the color. And but for the fact that I'm heading out to the airport, I'd be wearing pink. So Cindy and Sabrina, you are extraordinary. Woo! Really true. And that you had to overflow crowd here at the church, which is my favorite church. I mean, it's practically my church, even though I'm Jewish, because I spent so many wonderful hours here. But your first books were very popular and very important. The Empty Cup Runneth Over in 2007, Miami Breast Cancer Experts in 2015, and now expanding on your knowledge, your experience, and bringing in a network of providers in our community, experts who are here, many of them with us today. You bring in many of the overlooked functions of the body that have to do with response to cancer, breast cancer, the cardiac, the dental, the yoga, right? I know we have a yoga maven right here. So this book is an indispensable ally for those going through the treatment and the cure. Here's a quote from Marielle Hemingway. "It's so important to be informed as a woman. Cindy and Sabrina provide a compassionate and detailed look into the impact and most importantly the solutions to empowering yourself when dealing with breast cancer." Thank you, ladies. So that's why we're here, and there's going to be many words of inspiration and hope. But I'm just really, really thrilled to be a small part of it. And I will tell you that while I have not myself had breast cancer, my grandmother had breast cancer when I was a young girl, and she had one of her breasts removed. And that made a very big impression on me as a little girl. Of course, the treatments were not as sophisticated as they are today, and I imagine it would have been a very different outcome if she lived in this time. But, you know, we're all at risk. We're all at risk. It could happen to any of us. And I've just had this shared with me, this device, which is under experimental protocols and hopefully to be approved. And I will use it, and I will promote it. And I thank you so much for the incredible honor to join with you today so that we can work together to fight back and survive. Thank you.
Into the Rockstar Awards. Now we have a few people that are in the audience. I'll smile, I'm gonna cry, but our Rockstar Award, our Pink Warrior Award is very special, and it's one that we've given to survivors. And I just want to, if you could just stand up real quickly, those women that have received it before. I see Patricia, Pink Warriors, Linda, okay. Meeting. Just so you know, the image was done by an artist, and if you see that image of the woman with the arms and the looking up to the sky, it's a woman bathed in healing light, which we think is just so appropriate. So with that, I want to introduce one of our Founder Circle members. Not only is she past Rockstar Award honoree, she's also one of our biggest supporters. And, you know, I say, Joan, we have to go give food and clothing to the poor, and she's like, okay, she's got her sweats on. So she's a Founder Circle member, Joan Jimenez, with one son of his. So with that, I'm going to turn it over to Joan to introduce our first amazing honoree, who is also our Pink Ambassador.
Hello, everybody. The lovely Cindy Papelli-Hamilton is a 3-time author and breast cancer survivor. She is originally from Long Island, New York. Since her diagnosis, Cindy's passion has been giving back and helping others as they go through their breast cancer journey. She has appeared on South Florida Today Show and is a sought-after speaker on many radio and TV shows. Please give a warm welcome to the very special Cindy Papelli-Hamilton.
Congratulations. Thank you. Congratulations.
Wonderful, congratulations. Okay, our next Pink Warrior is someone who I've known for many years, who not only sits on the board of Baptist MCI, but went through her battle in 2020. She's amazing. She's done so many charities. She's been acknowledged by American Cancer Society Circle of 12. She's a household name. She's a mom, a super friend. Teresita Haskell Gutierrez. Teresa started her career as a model actress that started an apparel line in 2001, where the tops were committed to breast cancer and the bottom to ovarian cancer. She's ahead of her time, ladies and gentlemen. She found herself on March 30, 2020, in the peak of a world pandemic battling stage 2 breast cancer. Always been active in philanthropic work and her community, committed to her twin boys, James and Jonathan. Congratulations, Teresita. Is a woman who, let me tell you, every time we've had a silent auction, I've turned to Kathy and said, we need items. And she steps up to the plate. Not only does she step up to the plate, she makes deliveries. So I get a bunch of pink stuff delivered right to my doorstep, and it's amazing. Kathy is a local girl. She was born at Jackson Memorial Hospital and graduated from Coral Gables High School. How about for a local girl? Yeah! A graduate of George Washington University. In 1989, Kathy was diagnosed with stage 1 cancer in her left breast. She had a mastectomy followed by chemotherapy. In 2009, she was diagnosed with stage 2 cancer in her right breast and had a second mastectomy. Genetic testing showed that Kathy carries a mutation in the ATM gene and has increased risk of breast cancer. Kathy has been the chair of the Silent Auction Committee for the Day of Caring for many years. In 2015, she received the Mickey Whiting Award for Day of Caring. She supports breast cancer awareness by donating items not only to Miami Women Who Rock, but Susan G. Komen, the American Cancer Society, the Women's Breast and Health and Heart Initiative, and Cancer Link, Sisters of Hope. Kathy is grateful to be a breast cancer survivor for 32 years. Where's our beautiful Kathy to present her?
Here.
Last thing I want to say before I turn over the program is Cindy came up with this idea and called me up one day, and it's all about collaboration. And she said, how about we do this? And I'm like, whatever you say, you're the boss. You just tell me the time to show up. So she worked really hard at putting this event together. And it's not easy nowadays. So her, Sabrina, the whole team, I just want to, the morning girls, Julie Guy, Sabrina, all of the women that worked really hard on this event. It takes a lot of heart to put something like this together. To the medical panel that made it here in a rainy day, the mayor and everyone else involved. We love you. You rock, Miami. I'm going to turn it over now to the real stars.
2 girls in the morning and the evening. And it is strange, but wonderful all at the same time. This isn't our very first foray hanging out with the experts in pink, and we couldn't be more excited and proud to be asked once again to be a part of this, because obviously, as you know, well, we're not experts in pink, but we are experts at being women, and this is a very important, we don't have to say October is nonetheless one of the most important months, but breast health is important 365 days a year. We just love it that in October there's a big spotlight on it, right? So we're going to get started. We're going to have Tamara G get started, because I've talked already too much.
Great. Well, good evening, everyone. How are you? Yeah. I know everybody's like, okay, this is what they look like, right? Okay. Sorry. I know. Sorry to disappoint. No, I'm just kidding. We're going to bring up now Marilyn Dans. She is the founder of Pink Luminous Advocacy Program. She's a serial entrepreneur and has been featured nationally and internationally for her dedication to early detection of breast abnormalities. Let's bring her on up, Marilyn.
Thank you for inviting me to be here with you guys tonight here amongst such an amazing group of doctors, survivors, men and women entrepreneurs. It's really, for me, I'm incredibly grateful, and it's a blessing. My name is Marilyn Dans. I am the founder of the Pink Luminous Advocacy Project. It is a 501c3 foundation that works on two things. One, we have a breast awareness app, and I invite you after the event to swing by the table in the back. It is the first multilingual unisex app that downloads in the language that your phone is set in, with the 3 steps for men and women to know how to palpate and do regular breast self-examinations, and it synchronizes with your cell phone calendar so that you can calendar this. We live in an era, and it's interesting because of what's happened to us on a global scale with COVID, where we need to live an awareness lifestyle. And I think COVID has reminded us that we need to live an awareness lifestyle. And early detection when it comes to breast cancer is key. At the age of 17, I found a lump on my breast. And I'm going to be 50 in a few months, so that was over 30 years ago. Back then, they didn't do needle biopsies. They would take all the tumors out. And I'll never forget that moment. It was very impactful for me. I'm first generation born of Cuban immigrant parents, and it was huge. I had a drain, so it was very, very scary. The tumor was the size of a golf ball. And later in my life, my sister-in-law, at the age of 41, found a lump on her breast. She had had her first mammogram at age 40. And it had been 1 year and 4 months, and she ended up having 3 lumps on her breast. And luckily, she has a healthy lifestyle with my brother, her husband, and he actually found it on a vacation. And thank God for that. I mean, not everybody would find it that way, so the point is to find it. But she found it early enough where she was able to do radiation, and she didn't have to do chemotherapy. But I will tell you that she had 3 tumors, 1 year and 4 months since her last mammogram. She was 41 years old. And we have created, and it took us 3.5 years to publish our first clinical trial. It is a double-blind IRB study. It is the agency that dictates studies. They decide how many individuals are going to be in the study. And the technology is red LED light. It is the Pink Luminous breast. We are no longer selling them. We're going towards class 3 FDA right now. And if you got a little hand sanitizer, we invite you to go ahead and scan it and make donations. Any donation is not too small. Monthly donors will receive as a gratitude gift from us an Experts in Pink's book. So anybody that comes in as a monthly donor with the advocacy, all the funds are going towards clinical trials for the Pink Luminous breast so that every woman in the world can have it. And that clinical trial came in at the level of mammography. And it was with 296 women. That's what the IRB dictated. So we're really very excited to take this one step forward. We ask you to please support us in any way that you can so that we can start teaching men and women to live an awareness lifestyle. It is a lifestyle. It's like little kids. You teach them to floss their teeth, they'll do it always. And there's a lot of women that don't palpate. And using the Pink Luminous breast gives them the sense of sight. So now they can also see in conjunction with doing their palpation. It makes them feel a little more comfortable. So, Cindy, thank you so much again. Sabrina, thank you so much. Emily, you know that I love you, and I'm good.
We need to start some kind of movement to get these mammograms started at 35 and at 30. It's just what I'm hearing in all of the events that we're done, so maybe that's our next initiative. Can we get on that after tonight? We'll figure out how tonight goes. Just an observation. Right now I'm going to bring up the 2 stars of the show. You guys are the real stars of the show, Sabrina and Cindy. I'm not sure they need much more introduction, except for they really are rock stars. And they're the reason why we're all here tonight, so come on down.
I would like to call Marilyn back up because I would like to present a check on behalf of Miami Acura, Deborah and Wesley Skyders towards her project.
All right.
On behalf of Miami-Dade Acura, we'd like to present this check to you for $2,000 to hopefully this will be
Oh, it's huge. Thank you. That's
welcome. And then, what I'd like to do is, I'm really sorry I need to do this to our 2 Girls in the Morning, my favorite. I love them so much. They know that I do.
Oh, Cindy, you're our favorite.
Thank you so much. I have a little something for each of you. Your names are on them. In July 2000, and I don't want to go on too long because I want to bring the panelists up. But I was diagnosed with stage 1 multifocal invasive breast cancer. In July of 2000, I'm a 21-year survivor. I'm happy to say that. For many other survivors is that whenever we have to go for our yearly checkups, it's always very scary, but it's always good to be proactive. I do go every year. I get myself checked every year. And more importantly, this evening, I have many thanks to many physicians. We have Dr. Nick Tronicus, who came from Fort Lauderdale. Dr. Tronicus and I go way back. We worked at the University of Miami, Sylvester Cancer Center in Surgical Oncology. His story, listen to me, his chapter on surgical oncology is in Miami Breast Cancer Experts. It's one of the best chapters that I've read. But thank you, Nick, for coming. I appreciate it. And his wife, Anna, thank you so much for coming. We have Dr. Dennis Patton, and Dennis Patton is Sylvester Cancer Center Pain Management. And I'll never forget the day I had my mastectomy. I was petrified, and I was so afraid of pain that he made sure I had none. Thank you, Dr. Patton. He did a chapter as well. Also, Dr. Elizabeth Ann Roulette. Dr. Roulette, where are you? I don't see, there you are. Hi. Dr. Roulette is an amazing hand surgeon. She did the lymphedema chapter in Miami Breast Cancer Experts. She also did surgery on me, like 30 years ago almost. Thank you so much for everything that you do. Thank you. So Sabrina can share a little bit about our journey together. The organizations and foundations such as Bosom Buddies, Linda Burrows, You Rock, wherever you are, I can't see too far.
She's over here.
She's over there. Linda Burrows, thank you so much. I love you. Our conversations, 1 o'clock in the morning, we chatted many times when we both couldn't sleep. Thank you so much. Wonderful. The organization Bosom Buddy was founded in 1997. Thank you. Fantastic organization. Love you too. Patricia San Pedro.
All right,
Thank you. Hope Systems. We met in 2010. Patricia and I met at an event, the Day of Caring, where she was a model, and then I also was going to be a model. And I was petrified to get on the stage, and she had said to me, "You can do this, and you got this," and I did it. Thank you so much, Patricia. Thank you.
And the author of the book.
And yes, oh my goodness, cancer dancer. Woo-hoo. And what happened? It's available also at Books and Books and on Amazon as well. Actually, our books are together on the shelf at Books and Books. We saw that, remember? Right next to each other. And finally, also Farry and Pilar. They lead both so much. Pilar has done an amazing job putting this together between press releases. Farry also giving me advice and helping us this evening, and also on other occasions when we modeled at Bloomingdale's. Thank you so much, Farry. Thank you. Okay, so
It's my turn.
Hey, so you have time.
It goes to Cindy.
Oh, got 2 bites.
So some of you know the story of how Cindy and I met. I was in Dan Marino's talking about actually just cancer in general. My partner at the time, my business partner, was Alan Brentinson, the CEO of International Baptist. And we wanted to do something special for the kids at St. Jude's. So we were talking about St. Jude's, and we were talking about prevention. I'm a registered and licensed dietitian. Next year will be my 30th year as giving service to the community in nutrition in different capacities. Right now, the heaviest one is actually the #1 risk factor that affects women post-menopausal for breast cancer. That's what I'm highly dedicated to. Can anybody guess what that is? The #1 risk factor for women post-menopausal? One of the ones, people would argue, but there's a consensus that this is pretty much up there. What do you think? It's the weight.
the excess weight that we battle every single day. So postmenopausal and estrogen and fat just don't mix. So there's a consensus in the health community that we really need to do more to help people prevent the weight before we get to menopause. So it's not a pretty topic. You know, everybody has struggled in different capacities, whether it be with eating disorders or disorderly eating. What we put in our mouth is, you know, what makes us live. It's our fuel, and it should be a good experience. So there's a lot of people battling issues with their weight. They get up every day, they don't want to dress up, they're saddened, they go under surgeries that actually sometimes end up going the wrong way and lose their lives and leaving little ones behind. So I'm very committed to nutrition in the way of helping people with their weight, whatever weight they are at. And so when I was sitting at Dan Marino's talking about cancer, Cindy overheard. And we didn't know each other. This was in 2005. And she came racing after me. The valet took a little while. And she said, you know, I heard you talking about cancer. I'm a survivor. And I'm writing a book. And I want to see if you can participate in some shape, way, or form. And I said, well, I've never written anything. You know, I'm not sure how I can help you. I'm a nutritionist. And she said, perfect, you're writing the nutrition chapter. But then, little did I know, and that's why I call her an angel, and that's why I thank her every single day today. That's why I committed to be part of helping other women become aware of health prevention factor, right? You want to prevent breast cancer, you want to prevent disease. And 5 days later, my mother would be diagnosed with breast cancer. We had no family history. And for those that know me personally, my mother is my life. I love her dearly. She's a beautiful woman. She left Cuba 60 years ago, did not have children in Cuba because she was realizing that to do that would be an irresponsibility, and so she held back, and she got to this country almost at 30 years old, and she had my brother, my sister, and I. And struggled very hard. My mom was a professional in Cuba. She came here to cook straight from the house because she didn't know what else to do. So asking, you know, the neighbors would you buy my food if I cook for you tonight? And so watching my mother, you know, have burns on her arms and cooking and you know, getting up at 6 o'clock in the morning and her fighting to make sure that her children would go to school and have a good life in this country is one that many of us share as children of immigrant parents. So when my mother got breast cancer, my world fell apart. And I always tell Cindy, remember, we're committed to helping the women that are going through breast cancer, but remember that there are people around them that love them so dearly, whether it's their children, whether it's their husband, whether it's their sister, whether it's their brother. There's a family member that suffers dearly, and that would be me. My world came crumbling down. I had never experienced pain. I actually stopped working full-time, and I dedicated myself to taking to my mother to every single chemotherapy, to every radiation. And had it not been for Cindy and the book, the very first one, The Empty Cup, Running Over, which we came up with the name. If you think about what the empty cup is when you're empty, when your heart, when your soul, when your breast, when you're losing everything. So I was empty. Without my mother at that time, my mom, we're 30 years apart, so I'm happy to say this month, I'll be turning 52. My mom turned 52 in July. So we celebrate 30 years apart. And at the time, I was not prepared, and I begged God and I asked, please do not take my mother. And Cindy was there for me, and Cindy said, every step of the way, we're going to this doctor, and this doctor really is the expert in this specific, you know, radiation. And I said, well, good, because I don't know anything about radiation. And all the chapters, it was so special. You know, the fact that Cindy came to my life at the right time, that I made a commitment, and I said, I will be part of this in whatever capacity I can. And of course, life brings you to different situations, My mom just yesterday had a PET scan to make sure that she doesn't have, again, because my mom's breast cancer was not found from a mammogram. She actually had insurance where they asked her to do 2 mammograms in the same year. And my mother got diagnosed because my husband, who couldn't be here because he's on call, he's a surgeon, actually found a little nodule in her neck and said, we were on our way to a Christmas party and she was taking care of my son, and he looked and he said, your lymph nodes, I don't like that. Monday morning I'm bringing you in. And he was the one that actually found her cancer in her neck. And you know, that's why it's so important what Marilyn was saying, and it's so important to have this device available, so please donate and be part of it so that we can have a device in our hands every single day to make sure we don't have to wait for that mammogram that may or may not come. I ask my patients all the time, when was the last mammogram you had? And it's, well, inconvenience, the pandemic, my insurance, I don't have insurance, don't know where to get one, not sure, dealing with other life issues. So it's important to be proactive, it's important to know your body, but it's also important to have angels, and it's also important to have people who care about you and who actually are there for you. And so the caregiver, you know, thank you to Cindy for being a caregiver to me. Thank you for every single one of you who has had to deal with a loved one, you know, for helping them go through what they're going through. So this has been a beautiful journey. I wrote the chapter in nutrition. There are some recipes there. If you don't like broccoli, that's okay. It's the #1 food, by the way. Everybody always asks me, what's the #1 food to help fight cancer? Well, we have research that broccoli and wild blueberries can do the job. So there's recipes there. Nutrition is medicine. If we change the rhetoric about what food is, and we fall in love with it, and we stop talking negative about food, and we just bring the words love and food together, I think we will have a future where our children won't have to listen to our parents, our mothers, growing up saying, oh, you know, negative this, negative that. No, let's do a positive experience for everybody with food. I think that's really the future message. So Cindy, thank you very much. I really appreciate everything that you have done for me over the years to get me through my mom's diagnosis, and hopefully my mom's PET scan will be negative. I can find out next Friday, and it will be yet another celebration and possibly another book.
Yeah.
So apparently the person who eats nuts and blueberries every morning is somewhat right when we're in the studio. I'm not really sure who I'm talking about, but I will.
She should start listening to me just a little bit.
I'll put down my honey buns and
Broccoli and blueberries for breakfast, everybody.
okay. So we're about to get started now with introducing the panelists, and I want to go do some COVID.
Do you want to go get Dr. Ironside?
Yes, that's right.
Oh, right here, he's here. Sorry.
Okay, great.
I'm here.
COVID protocols here in the middle.
What do you
The sanitizer. Okay, Dr. Gail Ironson is a professor of health psychology and a board-certified psychiatrist. She has 250 publications in the field of behavioral medicine applied to HIV/AIDS, cancer, and cardiovascular disease. She's also current president of the Health Division of the International Positive Psychology Association, and she's written the forward chapter in Experts in Pink. Dr. Gail Ironson, come on up.
30 years older than me, and she's now 101.
Wow.
So I have to be very careful. And you know, I'm blessed to have her. We have another connection here, which is that when I was 50 and she was 80, we went to Italy. And so it's so interesting
We're
that...
going to Italy in December. The cat's out of the hat.
So says the Italian that's up on stage.
Great, so yeah, you can figure out how old I am. Which is always a surprise to me. But anyway, I met Cindy more than 20 years ago when she was an administrative assistant at the Psychological Services Center at the University of Miami, where I'm a professor. And I was immediately impressed by her bubbly nature, her enthusiasm for life, and her special caring for all of the clients who came in to see us, and how she would calm them down and make them feel better. So of course, when she asked me if I would contribute to her book, I couldn't say no, because she's such a lovely, caring person. How do you say no to somebody like that? And I'm also especially impressed with Sabrina because nutrition is so important. I mean, and the two of them have put this magnificent book together 3 times.
And in Spanish.
And in Spanish.
So that my mom can understand it.
And it our chapter not only includes the nutritional aspects of cancer, but also what supplements you should take. And as she mentioned, recipes. And I'm so glad to hear that broccoli and blueberries are number 1 and number 2, because actually they are my favorite things to eat. So now I'm going to eat them more. I have an excuse. Okay, so I want to tell you a little bit about the book. And really, it is a must-read for anyone who has either had breast cancer or who knows someone who has breast cancer, is taking care of someone. And you know, the amazing thing is that she got together, the 2 of these people got together, a group of experts, and had them each write chapters. So as opposed to many other books where one person writes a lot, you've gotten many, many people together. Okay, the terrific thing about this book is it's very readable, it's very interesting, and it enables us not only to cope, but to make better decisions about treatment, and also to talk with your doctors and know what questions to ask. So that's the great thing about it. All right, so what are the chapters about? First is about diagnosis. There's a chapter on imaging. There's also information on what to expect during diagnostic procedures, how breast cancers are classified, what the doctors look for with illustrations. It's wonderful. And so you don't feel like you're in the dark. Once diagnosed, there's now a series of chapters on treatment. So there's a chapter on surgery that's already been mentioned, different types of surgery, including obviously lumpectomy and the different types of mastectomies. Also in treatment is chemotherapy, and that also goes into staging. And there's a chapter on radiation, and the nice thing about that is that there are, in this newest edition, the 3rd edition, and I hope there will be a 4th. I would encourage you to do that, even though I'll have to write another foreword. And I don't even mind reading the book. It was so interesting that I really enjoyed it. So anyway, it includes brachytherapy, where you have a radioactive treatment source that's placed near the tumor, and so it spares adjacent tissues from radiation. Okay, then we get to after surgery. And so there's a series of chapters on breast reconstruction. So there's a chapter on plastic surgery options. There's a chapter on using your own tissues and fat for grafting. And then to enhance the reconstruction of the breast, there's a chapter on nipple tattooing and one on scar rehabilitation. The next topic goes into issues associated with breast cancer treatment and how to deal with it. For example, lymphedema. And there's not only how to recognize it, but how to lessen the symptoms associated with it. And other things that have been mentioned actually here already that people often don't write about, like dental health and cardiovascular, your heart health, they may be affected, and of course pain. So it's very nice to have chapters that deal with each of those things. And then we get to the emotional aspects of breast cancer. And one of the really nice, so how do you maintain your emotional well-being, both for the patient and for the caregiver, because that can be very stressful too. So the signature chapter on this is written by Dr. Sunit Kumar. I mentioned him in particular because he was a student at the University of Miami. He's one of my favorite people. I always invite him back for my graduate student lecture on psychological assessment in medical settings. And I'm sure you will enjoy that chapter. Then there's a chapter on yoga and meditation, which is great because it helps you to stay calm in the face of of dealing with breast cancer. And there's a chapter on the caregiver, which is also, I mentioned, very important. Okay, the next series, we're not finished. I mean, it would be enough if you just stopped there, but of course, she didn't stop there. So then there's a series of chapters on healthy lifestyles. And I mentioned the chapter on nutrition, which is fabulous. And it makes me hungry just thinking about it. Because it includes wonderful recipes. And also you include information on obesity too, which is great. And that was interesting to hear that that's one of the key factors postmenopausal. So good. I have to lose about 5 or 10 pounds, so I'm going to reread that chapter.
Join the club.
Okay. Then we have another chapter on specifically on obesity and surgical options. And there's a chapter on exercise. Now I have to mention that this is a particularly nice thing to include because as a psychiatrist, exercise is the equivalent of taking an antidepressant for mild to moderate depression. So it not only is good for your physical health, it's really good for your mental health. And in fact, in Britain, they use it as a frontline treatment. They send you for exercise and talk therapy before they'll send you for medication. Okay, and also with respect to exercise, the chapter specifically tells you what exercises to do that take into account the cancer diagnosis and cancer treatment. So it's very informative. All right, next story. The next section is on personal stories. And obviously one of them is Cindy's personal story. And her story beautifully leads you through the adjustments and the decisions that she had to make. And her exciting journey to writing books about it. Anyway, she's a shining example of resilience. Yes, and I'm sure you didn't need me to tell you that, but we know. Yes, we know. Very good. Great. Okay, and then Marilyn Van Houten wrote a chapter on how she found a lump, how she got diagnosed, but also how she discovered a new world of friends and people she could be with, and she joined the heroines choir. So for some people, as devastating as breast cancer is, it does open up a new world. All right, now, as I said, that would be great if the book ended there, but it doesn't. It's amazing. Now we get into some deeply personal issues, sex and sexuality. So this book doesn't shy away from difficult issues. So I'm particularly proud of you two for including things like that. Okay, and then there's a chapter if you deteriorate on palliative care, very helpful chapter, and a chapter on an often forgotten and stigmatized topic, which is male breast cancer. Very important that we don't neglect the men. And then there's finally a legal chapter. Okay, so to conclude, it's estimated that 1 in 8 women will get breast cancer during their lifetimes. The treatment information and decisions that you need to make after being diagnosed can be daunting and overwhelming. This book will undoubtedly help with dealing with and making those decisions. It's a great service that Cindy and Sabrina have done by putting this updated book together, and it has my very most enthusiastic endorsement. Thank you.
Our next panelist who will be coming up is Dr. I'll let you do this one,
She's my favorite. Everyone's my favorite. But, so real quick, an aside to Dr. Ironson saying that this book is a must-read and it's very readable. It is. And I have a sister who was just diagnosed with breast cancer last year, much like your mother, no history. Sherry, it's very scary, very shocking. All these events that I'd done, I still didn't know what to do, what was the first thing she needed, and she was out of town, she was in Canada. So what did I do? I sent her a copy of the book. I did. One of the very first things that I did, and I said, read this, and then I'll have people call you. And somebody I wished would have been in Canada for her is really one of my favorite people in the world, and I'm sure most of you know her, Dr. Carmen Kalfa. You know that I love you for all kinds of reasons, but one of the reasons that I do is her patient care. She's not just your doctor, she really becomes your friend and becomes part of your family. I've seen it firsthand. I know people who tell me, oh my God, you know her? And it's like, yes, I do, I'm very lucky. And we're very lucky that she's here today, actually, and recipient of the prestigious Zubrod 2020 Outstanding Clinical Researcher of the Year. She is leading the multidisciplinary survivorship clinical program at Sylvester, and obviously, she's written a chapter in Experts in Pink, and I love her dearly. Dr. Carmen Kalfa.
Thanks for having us tonight, and congratulations to you both and to the entire community for just getting this important task completed. As it was said tonight, breast cancer affects so many. It's 1 in 8, and if you count the stage 0, it's 1 in 7. So every one of us was affected, either as a physician or as a family member. And breast cancer is something that it's unique in many ways, because women are the center of the universe of every family, right? So it tends to affect the person, the caregiver, the family, and that woman from head to toe, literally. And somehow from the diagnosis until she dies. It's just the survivorship in breast cancer, it's the gift that keeps on giving. It's always something that it's either going to be in your mind, or it has affected your body and you're going to live with. So it's a very complex disease. And the good news is that we learn a lot, and we're able to cure 95% of those diagnosed at the early stage. So that's amazing. So that means the earlier the diagnosis, the higher the cure rates. For stage 0, we say 99% because in some places where pathology is not so accurate, they're probably missing the microinvasive. But stage 0 should not metastasize, should be 100% cure with surgery or plus medication depending on the surgical approach. For stage 3, the cure rate gets anywhere from 50 to 75%. And then in stage 4, we struggle and we really try really hard to find cures for those living with advanced metastatic breast cancer. But as of now, it's just not a curable disease unless somebody's super lucky, and perhaps about 5 in 100 will reach long-term remissions, and hopefully those are cured. We're able to really make progress and just move the needle a bit in the long-term survival for those patients with stage 4, but I still don't like to give the odds because they're just not good enough. So as a medical oncologist at the Sylvester Cancer Center, I really work with a lot of people that I trust and I trust in my life. And this book, and you know, really the beautiful thing is that in this book, many of the people that I trust wrote chapters, and they put their heart and love in it. And we really made this collection to serve those that are diagnosed or those that know somebody. Because the first instinct that people have is they go and they Google, and those information can be helpful perhaps just to find maybe a good cancer center to go to. But when it comes to really diagnosing and understanding your disease and making decisions based on that, it becomes really, really difficult, and it can take you really places that even emotionally you don't want to be. So what the book brings is a lot of expertise written by a lot of people that really care and they really know what they're doing. And the other part of the book is that it's really comprehensive, multidisciplinary, and really has a holistic approach. Because like I said to you, breast cancer does affect the woman and the family members and the man as well, from head to toe. And when it comes to the hair, we have ways to prevent hair loss these days. When it comes to the skin, the nails, the breast reconstruction, the side effects that come with chemotherapy, that's all part of what we really tackle in survivorship. And what I tell everyone that is diagnosed, survivorship is a precious state to be in, and people should not be settling for just living the way they are. There's so many ways that we learn to do and we can do, and from really being mindful and using exercise for our well-being and for our physical well-being, to really incorporating changes in the diet and nutrition. Like Sabrina said, this is music to my ear, because I'm just going to give you some statistics. If we used to give chemotherapy for about 2% benefit we used to overtreat about 98 out of 100. And people go for it. They'll just lose their hair, they'll throw up, and they'll be miserable for that. We learn to select those that now benefit or not benefit from chemotherapy. So you are able to spare about 60% of the patients that would otherwise get chemotherapy in the past, just because we know how to identify those that benefit. The other thing is the endocrine treatment, the hormonal therapy, comes with so many side effects. So if you look at the chemo plus the hormonal treatment, it cuts the risk about 65%. I'll tell you something. If you exercise 150 minutes a week, every week, moderate to high intensity, if you eat well and if you control your weight, the risk of cancer recurrence goes down to almost equal as much. So that additional benefit is not to be traded for chemo and endocrine treatment, but is really to be added to that. And with those interventions, not only are you going to have a less chance of a breast cancer recurrence, but you're going to prevent 13 other cancers by just having the lifestyle intervention that I told you about. So I couldn't be more grateful to be surrounded by amazing people like you all, and for having my favorites, both of them, and who I really love because they do so much for the community. They are everywhere, and they're everywhere because they care. And I don't even, I know they're everywhere because they care. And they go there and they talk to everyone, and they lead everyone to get to the best places for cancer treatment because they care. And that's why this community is so special to me. That's why I want to move, because I really love what we built here. And then you two ladies are amazing, and they call and they get the work done because they really care and they want to have this for anybody that's affected by breast cancer. So the book is a jewel. Thank you so much for having me tonight, and I really appreciate it.
Quite special because she signs Cindy's paychecks. So we're going to be really nice to her now. Obviously, she's got many, many accolades, as does everybody who is here this evening. Dr. Deirdre Marshall, board-certified plastic surgeon in Miami, one of Florida's leading physicians in plastic surgery specialty. Past 20 years, Dr. Marshall's held medical licenses in 4 states, 2 board certifications in plastic and reconstructive surgery, and in 2009, Dr. Marshall named South Florida's Super Doctors List. Are we lucky that we have her here tonight? So please welcome Dr. Deirdre Marshall.
Actually, it was a collaboration between my elder daughter, Erin, who's a UM medical student now, and she's heading into a career in plastic surgery. So we wrote the chapter together, and Erin did the book cover too. That's her friend. Who has a perfect one. Anyway, so I'm very privileged to have helped to write this book, and I'm here on the panel to answer any questions. Thank you.
Is recognized as one of South Florida's leading family cosmetic and restorative dentists and has over a decade of experience in the art and science of creating healthy and beautiful smiles. Dr. Darm has written the chapter in Experts in Pink on oral care, cancer care, and you, and understanding how it all comes together. Let's give her a round of applause. And a big smile, everybody.
Good evening, everyone. As you heard, I am a dentist. Many of you must be wondering what this has to do with breast cancer and its therapies. And I can go into much detail, but we will save you the burden of listening to that. My message to you tonight is to realize that the oral cavity, in many, many aspects, is oftentimes a mirror into our systemic health, and vice versa. As part of our cancer journey, its therapeutics, its lifestyle, and everything we have to go through, the oral cavity and the health that we have to strive for within our mouths will allow us in many aspects to traject this journey in a somewhat more comfortable and compliant manner. Without going into further detail in terms of what the specifics of that could be, our therapeutics, our oral, or actually our cancer therapeutics, including radiology, radiotherapy, chemotherapy, hormonal therapy, and the use of IV bisphosphonates, which are a very strong and very effective modality for the cancer, all of those have very common and yet very unique effects within the oral cavity. Most of the time, the common or the most common side effects or adverse effects that we can consider are swelling, pain, mucositis, stomatitis, which are lesions, both physical and chemical lesions within the mouth that can prevent us from properly digesting food, properly enjoying it, and taking in the nutrition that we need in order to help support the immunotherapy and the treatments that we have to endure throughout this time. So, in general, as part of your medical team, it is extremely important that both patients, caregivers, and physicians alike realize the importance of allowing and insisting on having a dentist as part of your care team from the beginning all the way through the end. The mouth has to be in impeccable shape in order to be able to sustain the effects of all of the therapeutics coming its way. Everything from stable gum health, stable bone health, the teeth should be free of any kind of disease, be it physical or chemical. There should be minimal to no inflammation in the mouth. It should be clean. The patient should not be wearing any kind of appliances that can cause acute sores, acute trauma in the mouth, because many of these therapeutics can affect the way that repair and healing can occur in the mouth. If we are to introduce that as an additional problem to go through during our therapies, it's going to affect the way the patient endures the medications given. Is going to affect their digestion. Digestion begins in the mouth. And most importantly, during this therapy, we want to make sure the patient is taking in good nutritious food and being able to actually swallow and taste and digest it. Where does that begin? In our mouth. It is rare for me to find in my practice someone, even a physician, a surgeon, an oncologist, calling me to coordinate this care. And that is extremely disturbing to me, because I have patients coming to my practice either with already an acute problem or an issue that we can no longer resolve because they are on therapeutics that will affect the condition of the mouth and actually prevent repair if we were to get to that at that point. So please realize, all of us here, whether it be a patient, a caregiver, or a physician of any kind, that the dental component for your patient is extremely important. First, to prepare for the cancer therapy, to endure the cancer therapy, and to actually increase and allow for a quality of life thereafter. I don't want to go on anymore because there's other people to speak. But if anyone should have any questions, comments, or would like to contact me, or please feel free to do so. My email is available, my office is available. I can take phone calls, so feel free to do that. Thank you very much.
Thank you so much. This is definitely not going to have all doctors up, so if anyone has any questions afterwards. Such invaluable information. We just don't realize how everything in our body works together. So this book definitely a must-have. Now it is our pleasure to bring up Dr. Alejandro Medina, a hand and upper extremity surgeon at the Medina Hand and Shoulder Center in Durrell. I believe I was watching on Facebook Live. You had your own incident. So you know, didn't you? Didn't you have something happen in was it your knee?
Oh, my knee, yeah, my knee, my shoulders. Yeah.
I knew something. I knew you were an expert, not just because you were an expert, but you actually lived to tell the tale. So Dr. Alejandro Medina, one of the chapter authors of this.
Patient education, anybody who knows me realizes that I feel that physicians oftentimes, we don't spend enough time educating the end user of healthcare, which is a patient. I just got an announcement, a book chapter I'd written about 2 years ago, just finally being published, a big arthroscopy textbook, and I remember thinking I actually wasn't that excited about it coming out, because I realized that people who are going to read that, they're going to have some knowledge in that particular area, but when I write something for patients, and it comes out somewhere in popular media, that is impactful. And that's why I was so pleased to write the chapter on hand and the upper limb, because women and their families, really, it's a very difficult time. And for them to have this information is so vital. So I really think as a society, we need to do much more. I cannot pick up news about medical, and it's always about something aesthetic, but yet, issues that really matter where people are suffering or maybe their lives are at risk. We just don't talk about this enough. I've been in town 25 years, and many times I've reached out, to our one daily newspaper, the Miami Herald, and really can't get these topics covered enough. So I have to say I'm actually relinquishing my subscription after a quarter century because it's, it's just frustrating. And I think that we as people have to take a stand in this. One of the other things that came about as a book, as Cindy knows, and not to meet Sabrina, which is wonderful, is that at the cocktail party, I met the person who helped put the edition of the book together, and I said, I've been thinking about a book about the challenges of healthcare delivery. So the other thing we don't talk about enough, right, is you get diagnosed, you find a lump, all of a sudden now you got to fight an insurance company, and you've got to fight bureaucracy, you've got to fight a big hospital system perhaps, and the publisher of the book, what turns out her father's a vascular surgeon in Philadelphia, and I told her about my idea, and so we wrote that. So that came out. I wrote pretty much the whole thing during the 10 weeks of the lockdown during the pandemic, and that's called Healthcare from the Trenches. So if you just Google Amazon trenches, the book will come up. But it talks about all the challenges in receiving this type of healthcare and many different types of care that we know is increasingly complex. We live in a country, thank God, where we have all the latest advancements, but accessing that care can really be a challenge and paying for it. And I'm deeply passionate about that. And I only hope that there could be more dialogue. The chapter on the hand, it's representative of so many things in medicine where there's misconceptions. Just the other day, I had a lady with a wrist fracture that had to put a little titanium plate in her wrist on the end of her radius. And the nurses in our surgery center were very concerned because she'd had a mastectomy. And I said, well, the literature is actually borne out that isn't as problematic as we think. But yet, once in healthcare, once there's a myth, it's very hard to combat. So now I'm going to give that nurse a copy of the book. I'm going to start with this chapter. And because it's just, medicine's pervasive. Another misconception about the hand is people think that computer use damages your hand. I'm going to recognize my children, Alessia and Alessandro, who are there, and at their age, they're on computers a lot, on little devices, but their hands are not really at risk. But yet that's something that in popular media is talked about. So one of the things in perusing the book is there's a lot of areas that I don't know a lot about, and I was fascinated by some of the misconceptions that I had about breast cancer. So really that was the idea of the book, and I'm so pleased that you did this, and so honored that I was able to participate. Thank you.
And before we introduce our last speaker, if we can have all of the speakers that have already been up, please come up to the front now because we are about to start the Q&A as soon as we get Dr. And is it Kesmodel or Kesmodel? Kesmodel. I'm from Texas, as y'all can tell, so it's Kesmodel in Texas, but Kesmodel here. We almost won that game tonight. Did anybody see the OU Texas game today?
We're in Miami.
And again, did anybody see a real team play today? Sorry. We lost OU. 10 seconds left in the game, but that's beside the point today. All right, Dr. Kesmodel is an associate professor of surgery in the Division of Surgical Oncology in the DeWitt Daughtry Family Department of Surgery at the University of Miami. She has written numerous articles on breast cancer management and outcomes, and recently helped develop, author, and edit a new handbook of breast cancer and breast diseases. She has written the chapter in Experts in Pink on advances in breast cancer surgery, optimizing outcomes. Dr. Susan Kesmodel.
Years now, and when I came here, Carmen, my colleague, introduced me to Cindy and Sabrina, and they really embraced me and brought me into the breast cancer community, and I thank them for that. I also thank them for providing a guide for women, because when women have a diagnosis of breast cancer, it's a very scary thing, and we see women of all ages. I have women women in their early 20s coming into my office with breast cancer, and I also have women in their 90s. So it's a disease that affects women of many ages. Many women have children. It affects the family. And being a surgeon, it really affects the physical and emotional well-being of each woman. And I think one of the great things is that we've really made significant advances in breast cancer surgery. And the goal really is to have a woman feel whole at the end, and that can be many things. That can be a lumpectomy, that can be a mastectomy with reconstruction, or that can be a mastectomy without reconstruction. This is not a one-size-fits-all. This is a personalized, individualized approach for each patient. Each patient's different, each cancer is different, and each patient's desires and wishes and goals are different. So as a breast cancer surgeon, my goal is to try and figure out what's best for each patient. If a patient wants to try and have a lumpectomy, and I think that's possible, we do that. But sometimes it's not possible, and we have to go with a mastectomy. We have great reconstruction now. People like Dr. Marshall have really improved the reconstructive outcomes for women. So I think the goal is to try and get women past their diagnosis, past their treatment, and to move forward. As Dr. Kaufman mentioned, we have a lot of issues with survivorship, endocrine therapies, which have a lot of side effects. And so even after the treatment, there's many things that can affect women. And as Dr. Benita mentioned, lymphedema is something which is really a problem that has to be managed for your lifetime. The good thing is that we don't have to do as much surgery anymore. We don't need to take out as many lymph nodes to achieve the same results. But there are still a small group of women that end up requiring lymph node removal, and they end up with lymphedema. And we have really started to focus on this in the last 15 to 20 years, and we have many surgical options besides the kind of physical therapy and occupational therapy options. We also have surgical options for management of lymphedema. And we're really trying to improve the survivorship because there are millions of women and men out there who are survivors, and we want to try and allow them to lead happy and healthy lives with their families. So I really thank Sabrina and Cindy for championing this book. It's a really nice guide for women and families, friends, anyone who knows someone with breast cancer. And I'm really just happy that I was able to be a part of it. Thank you.
It's really remarkable, and it's really invaluable to see how everything comes together. In all the years that I have had experts on my show, and I've had this and that, and Dr. Paul has been a frequent guest, I have heard and seen the advances just by listening, and it's pretty remarkable, and this book is invaluable, definitely a must-have for everybody, because we're all affected in some kind of way, whether it's family, friends, or ourselves. So big round of applause for these physicians. And actually now is the time when if you have a question, you may ask. So anybody have any questions for any one of our physicians, now is the time that you can ask away.
It doesn't cost you a $40 copay.
The comedic relief here this evening, Tamara.
Thank you, everybody. Thank you, ladies and gentlemen. I'll be here all night.
Not really. Do we have anybody with any questions? Come on.
All right.
Come on down.
Yeah, first
Would you like to come up and I know, you don't have to be shy. We're all in this together if you haven't already noticed.
She's loud as we are.
Someone needs to be careful not to adhere to, because let's say they have, like I have a friend with ovarian cancer, if I send her the book, is there anything in there that wouldn't apply or would actually be detrimental?
Who will take that question?
Good medicine in general. There are specifics about treatment for breast cancer. So she won't find specifics for ovarian cancer. When it comes to general health, dental health, nutrition, exercise, they're all great advices that are applicable to all cancers. So still a good guide. It's a great guide. Yeah, awesome, thank you. Great.
That's a good question.
As somebody that has lived through this, I think I've found surprisingly the hardest part is after. And, you know, because going through it, you kind of are a machine and just in survival mode, and then it's done, you're in this now what phase. And I guess my biggest question is, have there been any developments as far as screening for women that have had mastectomies? It's a very strange place to be, you know, where it's, you know, a friend said to me, so do you still have cancer? And I was like, I don't know. I mean, I hope not. But there's really no screening that I'm aware of that can tell me if there's micrometastasis somewhere in my body. So I was just curious, you know, any thoughts or information?
First, right? Post-mastectomy screening and then
Let me clean that right quick. Can y'all tell who has the OCD?
So there are really no guidelines for imaging after having bilateral mastectomy. Could you get a
little louder?
Sorry. Okay. There are no guidelines for imaging after having bilateral mastectomy. If you have a lumpectomy, then you would be considered for mammogram or MRI. If you have a unilateral mastectomy, you would again get mammogram and MRI. But for women with bilateral mastectomy, really the recommendation is to just do clinical exam. Unless you have silicone breast implants, the recommendation is to get imaging every 2 to 3 years just to evaluate the integrity of the implants. What I've seen in my practice is that that's not recommended very frequently. I just do this on a case-by-case basis. If I had a patient who had more advanced disease or had a close margin from the surgery, then I might add MRI imaging to their follow-up evaluation. But again, there are no strict guidelines, so again, I think you just individualize it for each patient. And then in terms of systemic imaging, I'll let Dr. Calvin handle that.
Clean that off for you.
So I think your question had, apart from the micrometastasis, something distant or just the breast only? Just want to make sure I address it fully. Go ahead.
Any of it, you know?
Yeah. Okay.
Are there still cells floating around in my body?
Yeah, so that's where I'm going to just make sure that we clarify. So just going to what Dr. Casmano said, post-mastectomy, post-bilateral mastectomy, there is no guideline-based screening. But when you think about Angelina Jolie's story, right, that was the one that everybody knows, when you do bilateral mastectomy, even somebody that was never affected by breast cancer, the risk of developing a new cancer, it's not zero. So we quote that that's less than 5%, maybe less than 2% if the person is super skinny. And we have the surgeons right here to testify that there is no clear plane in between the breast and the fat and the rest of it. So that's why, because you can't scrape up your breast cell, technically, if there's any cells that were left behind, potentially those can catch on fire, and that's why the risk of developing breast cancer it's never zero, even after post-mastectomy. So that's about the local new cancer, right, the new primaries. But then the other question that haunts people that survive initial breast cancer is really the risk of a distant recurrence, those micrometastases that potentially could be there, and they could, depending on the type of cancer, could come back 10 years later, 15 years later, 20 years later. Estrogen receptor positive can come back up to 3 decades later. And that's the biggest fear. That's the one that can technically hurt somebody or take somebody away from us, right? So what's the surveillance for that? And that's where people are having a hard time, and it's understandable that you come to the doctor and you say, how do you know I'm cancer-free? Can you run a test to show I'm cancer-free? And that's the one that causes a lot of anxiety, and it keeps people people up at night, and every symptom that comes after breast cancer makes you wonder, is the cancer causing this? And the truth is, we don't really have a way to do surveillance to find those cells at the microscopic level. We're really moving the field to really look in the blood for free DNA and just do the surveillance in that way. But what we don't know now is if you find those free DNA in the blood, what do you do with that information? Do you give again chemotherapy or hormone treatment to somebody? So in short, I tell them, and the surveillance is symptom-based and physical findings. So that's why I need to see the oncologist at the beginning every 3 months, and then every 6 months, and after that every year, because those new symptoms, they need to be discussed with the oncologist, and if they potentially could represent a recurrence, then an image with a PET CT scan or a CAT scan or a different ultrasound or something is warranted. But other than that, we don't just search for those potential cells, because it comes with the fear of finding false negatives or incidental findings that they're going to be chasing for the rest of their life, and they'll just bring more procedures and anxiety. And when studies were done, they did not change the outcome. So I hope that answered your question.
That's the same thing I've been told, unfortunately.
I know, but I think we're moving towards the tumor, the free DNA. But when people ask me, how do you know you're cancer-free? I say the same applies to every one of us. Even if you're never affected by breast cancer, how do you know that person is cancer-free? The body gets every day bad cells, and the repair mechanisms are trying to get rid of those, and the immune system works. So when you look at the rest of the people around you, it's like they know as much as I know, and that's the truth. And that, I think, is reassuring. When we have those conversations with the patients, like, oh, okay, I get it. If you feel fine, you feel great, and you don't have any symptoms, then I'm looking.
You want to? Who doesn't know Pat San Pedro? She's a rock star.
Hi. I have a question. I'm a 2-time cancer survivor. I had breast cancer. Amen. I had breast cancer, and 3 years later, I had melanoma. And I've gotten different responses when I ask that question of doctors. Is there a correlation between my breast cancer and my melanoma that took a big chunk of my arm off? Where's the mic? Because I got here. Okay. Here. So they won't be catching COVID up here. How about that?
I don't know if I know the answer, but we do know that some genetic mutations increase the risk for both, for breast and melanoma. So when we have patients like you, we recommend genetic testing, and these days, the trend is to recommend genetic testing in almost everyone, and I hope you have it. But the trend is now not to find the people that qualify for genetic testing, to find the people that don't qualify for genetic testing. And melanoma is sitting, it's increased risk for melanoma for those with the BRCA1 and BRCA2 mutation. But there is also some other genetic mutations that increase the risk. So if you find a gene that potentially could increase the risk on both, then you would say that that's linked to that gene. But is there a correlation between breast cancer and melanoma? I'm not aware of one. Anybody feels differently about the correlation? Genetic testing?
Huh?
Genetic testing?
I did the genetic test. I didn't have the BRCA gene.
So I'm going to say that genetic testing has evolved significantly, and years ago we just had the BRCA1 and 2, and then we added a couple of more. As of 3 years ago, we're testing 18 to 20, and now we have 83 and 14 panel. And those new genes are, are increasing our awareness and finding families that they had all along clusters of family members with breast cancer that they couldn't understand and explain why. And those patients that had genetic testing for BRCA1 and 2, they are offered to have additional genetic testing. So everyone that comes to my office every couple of years, we're looking. And then when you still have these clusters of families and you don't have a gene as of 2021, a few years from now, perhaps we will. So just what we don't know today doesn't mean that there's not a genetic link or mutation to explain that.
Thank you. I'd like to start on the right, and if we can go down the panel so we can hear from each person. What are the top 1 or 2 most common questions you receive and the answers you give in your specialty?
Well, in dentistry, the most common issues that come up, more so than questions, because oftentimes patients don't know what to ask. Don't understand something is happening in their mouth, but don't know that it's related to their therapy, and sometimes it's quite obvious. A few of the more prevalent issues are xerostomia, which is dry mouth. It's very common to feel that and to assess it because of all the various modalities of therapy, especially when they're in combination. That is one of the key issues. Another one is osteoradionecrosis, which is basically, in very simple terms, it's the inability of the jawbone to repair itself or to heal after an extraction or any kind of surgical intervention in the mouth that involves bone. Any kind of bone injury in the mouth while undergoing certain types of cancer therapy, especially bisphosphonate administration, can cause a lack of repair and an inability to heal. So that is a very big problem that needs to be sequenced and addressed with the medical team before the cancer therapy begins. So osteoradionecrosis, the xerostomia, and as I mentioned earlier, the inflammations and the oral lesions inside the mouth that affect the lining, the mucosal lining of the mouth, meaning the soft tissue. It feels like it's burning, it feels like there are open wounds. Certain foods make it worse. Trauma from dentures, from partials, from ill-fitting orthodontic appliances, everything that can cause trauma inside the mouth causes a lot of discomfort during cancer therapy. So I would say those are the three most common issues that we deal with, and much of that, if not all of them, could be prevented or significantly reduced if proper planning and sequencing of therapies is considered in the beginning. I hope that answers it.
What should I eat? I guess is the most common. But medical nutrition therapy, which is what I practice, has to do with every single medical disease in existence that we know of. So we have cancer. When we have a client that comes, with diagnosis of cancer, what their biggest concern is should I throw away my microwave? At what point did this become my fault? What did I eat that caused it, could have caused it? The fear of the weight, whether it's because you have too much weight or too little weight, sometimes is a big problem too, because you have to struggle and fight through the radiation and the chemotherapy, which changes everything. When Cindy and I asked Rita to join in the third book for the chapter, it was because my mother, I asked her one day, I said, Mom, what was, because it wasn't nutrition, my mom wanted to finish chemotherapy, and I wanted to make sure that she did not have nausea. Has anybody ever felt nausea for a little while and had to throw up? It's probably one of the worst feelings. And I know it because unfortunately, I don't know, I guess I had that experience at one point, and I wanted to make sure, that my mom did not experience it. I know it from my patients too that I had worked with, especially in the hospital in the clinical setting. Nausea and vomiting could kill you, and the reason they can kill you is because you stop eating. Because when you don't nurture yourself, when you do not eat because you can't eat, because you have sores in your mouth, that's potentially probably one of the reasons that people get cachexic with cancer, and you see that they start losing their muscle mass, their body fat, and then they just waste away, and that's the word that is used for HIV patients, for cancer patients who are not thriving because they're not eating. They're not getting the food they need, whichever way they can. So the oral cavity became very important for my mother because she did have, at some point, sores, and she did have problems with losing teeth because of the medications that she was actually receiving. that would potentially save her life. My mom had a very aggressive cancer, like I mentioned before, that was in her lymph nodes. You know, it depends where you're at. I want to say the fear is the worst. Coincidentally, you know, the question that was asked over here has been a question that has, you know, been in my mind. I guess with COVID and having a 96-year-old father and an 82-year-old mother, I wanted to make sure that she had no fear about another diagnosis. And we talked about it. And so my answer to that, I think, because I think patients come to me with fear, and we have time, I can dedicate an hour and a half with my patients and really get to know them and feel where they're at. And my mother started, you know, talking about, you know, she had symptoms, she had feeling of it, her voice started going, and this was not COVID, this was from just a cold that she had. So I would say that if you get to know your body really well, and that's what I tell my patients, no matter what they come to me for, whether it's to address the issue of obesity, whether it's to address an issue of cancer or HIV or, you know, colitis or whatever they may be going through. Know your body, because if you know the way that you feel well, if you're sleeping well, that's a great sign. If you have appetite, that is the best sign of all. If you are able to have energy pretty much throughout the day, it's okay to have a 2 o'clock, 3 o'clock little nap or feeling like you need one. But if you don't have things that are flags because you know your body, you know, you're pretty much going to work probably with a therapist in being okay. Because living for many years, my mom's been living for 15 or 16 years with, you know, cancer-free, but the fear is always there. My very best friend also had non-Hodgkin's lymphoma, and we've talked about this. So getting to know your body is something that I really, you know, hone in on. Nutrition is not about just the plate you put in front of yourself several times a day. Nutrition is everything you nourish yourself with. So whether it is spiritually, whether it is physical, mentally, whether you stimulate yourself educationally, these are all nourishments that at the end of the day feed yourselves. So you know, feed yourselves and feed your soul. It's very important to be whole.
All right, thank you.
As a surgeon, I frequently see the patient right after their diagnosis. They go to radiology, they get their biopsy, and they come to my clinic. And so they're very, it's a very emotional visit. And, you know, they haven't seen anybody else. They haven't seen a medical oncologist. And so the 3 questions that I typically get are, why did I get this? Which is a huge question. Am I going to live? And how am I going to look? And those are big questions to tackle, you know, because I think a lot of women think there's something they did wrong about why they got this. If they had done something differently in their lives, they wouldn't have gotten this. I mean, obviously we know there are genes that contribute to the development of breast cancer, but it's just multifactorial, and there's not one thing that you can put your finger on. Some women are on hormone replacement therapy, and we try and, you know, wean that off over time. So, you know, that's a loaded question, and I usually tell patients that, you know, we don't know why you got this. It's probably many, many things, and nothing that you particularly had control over. I do talk a lot about nutrition and exercise and maintaining your weight after menopause and not drinking too much and a well-balanced diet, because those are key, not just for breast cancer, for any kind of cancer. And I think that, as Dr. Calfa mentioned, that all those things are very useful for helping patients get through their treatment and recovery. The second question about am I going to live? That's also a huge question. Breast cancer is not one disease. It is many different types of cancer, different stages. So I would try and reassure the patient that we're going to get them through this journey and that we're going to be there. We've got stage 1, stage 0, stage 1, stage 3. I have some stage 4 patients in my clinic, but most of my patients have stage 0 or through stage 3. And then, of course, the cosmesis is a huge concern. And again, I try and tell each patient that we're not absolutely sure how things are going to end up. We are much better at our cosmesis. Our plastic surgeons are fantastic. We can do a lot of moving of tissue around to try and kind of shape the breast to prevent areas of indentation. But it's really hard to determine what that ultimate cosmetic outcome will be. But again, I think it's trying to reassure the patient that if things don't turn out exactly how we would like, that we're going to do something to try and help them fix that or move things forward.
2 questions I get. The first one would be, is lymphedema curable? And the answer, unfortunately, is really no, but it is very manageable. So I tell them, just like much medicine, you really want to see the specialists who are lymphedema certified, usually occupational therapists.
Push it really.
And the second question is, I alluded to it before about whether you can have IVs or procedures. Women are often very afraid they stain a cut on her hand, whether that's going to be, and the reality is that more recent studies have shown it doesn't make as big a difference, so I try to reassure them. Certainly if you've had a major lymph node resection, then yes, it may be some issues. But if you have a major, say, elbow reconstruction surgery, there could be some problems with that. But we have ways to counter that and just be a little bit more aggressive. So again, it all comes down to education, and that's the goal of the book.
Probably the most frequent question is the one you just asked. How do you know cancer free? That's the one that I know how much it matters and how much the person wants that reassurance. And the truth is I do fall for the tumor markers, and we can talk more offline. But the other question is, usually the person asks, when shall my daughter or my granddaughter or my sister start having breast images? Our family history is low in breast cancer, and I was diagnosed at 45 when shall I start mammogram. And it was sad tonight that we see a lot of younger women getting diagnosed with breast cancer, and that's a real trend. So the rule of thumb is if the person has no additional risk factors, and it's just at the average risk, that the age to start the mammogram is 40. But for anybody that has additional risk factors, then there is a way to quantify that risk. And depending on that quantification of the risk, a mammogram once a year may not even be enough. So for those that are considered high risk, that's 1 in 4 as opposed to 1 in 8 in a lifetime. That's 12% average risk times 2. That's 24, 25%. And you get there by either drinking every day heavily or by having one family member of first degree relative, especially at younger age. So just keep that drink in mind. It actually equals a first degree family member with breast cancer. So when you quantify the risk, and we have programs that are not only seeing patients with breast cancer, but we see the daughters and the family members that are at increased risk. For those, the age to start the mammogram is 10 years younger than the youngest family member. So if the mom was 45, the daughter has to start at 35. So that, and if the risk is twice as high, which is now, 24-25%, a mammogram once a year, alternating with an MRI once a year, that's what we recommend. So that changes the way that we follow these younger women that are at high risk of developing breast cancer. And the good news is if you diagnose it on our watch, it's usually a much earlier and much more curable cancer. my usual answer is, look at me, do you think I would poison anybody? I really wouldn't. And if I did poison somebody, I wouldn't still be there for so long. But I end up explaining to everyone, what that chemo can do for people. And once they understand, they almost want that chemo. They actually want that chemo because they understand that chemo is to really get rid of the cancer. And we're really much better than we used to be. That nausea, vomiting, the things that used to make that chemo so dreadful, it's now so manageable that people go through chemos, full-time jobs, small children, running businesses, and they do it. And the other good news is that we like to give all these drugs, ideally for most of the patients that need it before they have the surgery. So when that is modeled in the plastic surgeon and the lymphedema question comes in, the risk is so much less because the treatments are so much more effective. And even beforehand, they can shrink the tumor and they can make the surgery, the axillary surgery, the reconstruction, and all that so much easier. So, seeing patients and having their questions, I think is just an opportunity to really give them good answers that makes them comfortable and want to do the treatment. Thank you.
Question, because this new diagnosis has been suddenly thrown out, and they're not experts in the area. They haven't read this book yet. But a very important question, which I am posed frequently by a person coming in who has been advised by their surgical oncologist to have a mastectomy, is should I remove the opposite breast? What should I do with the other side? And even if the patient doesn't ask me that, I bring this issue up because when they come to see me for the first consultation, that's the decision that we have to make is what type of treatment is the patient going to have. And the surgical oncologist gives them advice, but they also like for the plastic surgeon to give them advice as well and give them all the options. So in general, just based on my many years of experience now, like looking at women, putting myself in their place and seeing so many young women who are active, who have children, who want to stay alive for their children, to see their children grow up and see their grandchildren, I always say, well, if I were you or you were my family member, I would be aggressive, as long as you're a good candidate for the surgery and, minimize your risk as much as possible of having a recurrence. Just do everything you can to get rid of anything bad. And you do a great reconstruction. And many times, if we treat both breasts the same way, say do a bilateral mastectomy, the patient is going to have a lot less surgery for a better result. So I'm almost always a fan of going ahead and advising for the patient, no matter what her age may be. If she's been medically cleared, she's a good candidate for surgery, whether she's 21 or 79. Go ahead and consider doing the same thing on both sides, because I know I can do a better result, whether this is in cosmetic breast surgery or breast reconstruction surgery. I look at the two things the same way. I want to help the patient be rid of the cancer and survive, but I also want the patient to look normal and maybe even better. So it's something to bring up right away in that first consultation is what do we do with affected breast and what do we do with the opposite breast? And then I'll make it short, but a lot of patients say, can I keep my nipples? That's another thing. Back in the day when I was a resident, we took everything off. We just did whatever we could to make a lump. This was the early days of breast reconstruction, about 30 years ago. Now we can many times preserve the entire skin envelope. We can do things that we didn't used to be able to do. But I have to explain to patients, whether or not they're a candidate. A lot of it depends upon where the location in the breast is of the breast cancer, other things they might need to have done. So I think those are very common questions. What do I do with the other side, and can I keep my nipples?
Next topic. And I discuss it with every patient that comes in because the studies show that it does not improve survival to take the other breast off. A lot of women think that they're at a very high risk for having a cancer in the other breast when that's actually not true. So I think those decisions about doing one side or both sides, again, really need to be individualized for each patient based on the age, the family history, the type of cancer, because you can have real complications when you're doing bilateral mastectomy. You can have infection, You can have problems with the skin healing. Those things can actually lead to additional hospitalizations and complications. So again, I think it's definitely an option for women, but I do counsel the patients that by doing both sides, you are doubling your risk of surgical complications. We discussed that it does not change their outcome from their breast cancer. And also when you do a mastectomy, you lose sensation in the skin and nipple. And for young women, some of them do not like that aspect of the surgery. So again, I try to lay out those pros and cons with the patient so that we understand what the goals of doing the other side are. It is not to improve survival. It does provide better symmetry. It does reduce risk of getting a breast cancer in the other breast, but that risk is really overestimated by most women. So again, it's a complex discussion.
Thank you, thank you. I'm not a physician, but I'm going to speak as a survivor and an advocate for many, many women with diagnosis of breast cancer. A lot of times a patient will come to me asking me a referral for a good physician. Now, of course, I know many, and I try to, I do refer, and of course, personalities, you have to see if they are happy with that physician. But most of the time, the physicians that I do refer to the patient, they're very happy. So as an advocate, I love helping people. They'll say to me, for example, just with Dr. Marshall and Dr. Kesmodel were talking about, should I take off my other breast? There's a word called fear. And a lot of women think, oh my God, I have to take the other breast off. I'm afraid it's going to go over to the other side. I know that the risk factors might be low, but I am afraid, and I don't want to live every day knowing that the cancer possibly could come back on that side. Or a lot of times people want to have symmetry. I just don't want to have maybe an implant on one side and not on the other. So it's a personal decision, and it's a very important one, because today, it doesn't mean you're going to get cancer on the other breast. But again, the word fear, everybody has that fear, oh my God, I don't want to live knowing if I have to, if they find something in my mammogram, now what do I do? So that's what, as a survivor and an advocate, that's what I try to help people, and I refer to great physicians that I know.
Another question? I have one more question. As one of the common questions I ask at my office, and this is more for all of you where I would like to take it. As a dentist, for patients that have been in my practice for a significant amount of time, they ask me my opinion about sometimes non-dental issues, oftentimes medical. And as related to breast cancer, one of the more common questions I get from the earlier or the younger women in my practice, or the ones that are recently beginning their menopausal stage, is whether or not they should consider the use of hormone replacement therapies because of the risk involved with breast cancer and all else. So I have done my own research and I've read and I have an opinion, but I would love to ask that of you to make sure that I'm on the same page and just to understand what the current conclusion or thought is.
We used to have women going on hormone replacement therapy and staying for decades, and still see them. And we know that long-term use of hormone replacement therapy increases the risk of breast cancer. So we also have additional tools to really correct any symptoms that come with menopause. Almost all of them that are different than hormones these days. And I joke about and I say we no longer need estrogen replacement therapy to fix wrinkles. There's Botox, there are fillers, and honestly, they are safer when it comes to the risk of breast cancer. There is the hot flashes that women usually suffer from that are also put on hormone replacement therapy for the same reason, and then they're forgotten on it. If you want to go on for a couple of years, right when you go into menopause, it's a lot better that is staying on for a decade. There's also these bioidenticals that people have a feeling that are less than just the hormone replacement therapy when it comes to risk, and that's not true. There's also pellets and other things that are provided, and there are different levels of different hormones that we never studied in medical school that people out there check out patients for, and then they're making different recommendations that, again, are not guidance-based. So in summary, hormone replacement therapy potentially can be considered if the symptoms are very severe, but the recommendation is to keep it as short as one can be on. And then for hot flushes, there are antidepressants, Celexa, Effexor, they're great. There is gabapentin, there's Lyrica, there's even the Detrol, which women use for bladder incontinence as they reach menopause. That Detrol was just added to the hot flush medication, and people love that drug. It's easy to take, it's very well tolerated, so hot flushes are no longer an issue. The wrinkles we talk about, the weight gain, there's a treadmill, and there's Serena to tell us more about that. So please keep those hormones, as few years as you can if you really need them.
Dr. Kesmadale, did you want to, and then this will be the last one, we promise. You guys, she's like, no.
Go ahead.
Do you want, here, just explain.
I agree that you should try and keep the hormone replacement therapy to a short course. Exercise, I think, is one of the best ways to get through the symptoms of menopause. The issue with vaginal dryness is something that many women have, and particularly breast cancer survivors. We have a breast surgeon at our institution who also focuses on sexual health, and some vaginal estrogen. Once you put vaginal estrogen in, it actually helps to, I'm going to say heal the walls, rejuvenate, the walls of the vagina, and you don't get as much systemic absorption of the estrogens. So I think for women who are particularly having issues, sexual issues because of vaginal dryness, that is an option. And that's something that a lot of patients do ask me because,
And there are some men here who are like, this is way more information than we ever needed to know, right?
They need to know. They need to know.
But again, I do think you can use vaginal estrogens.
Yeah, we have vaginal estrogen even intermittently, it's safe. So that's great news. I think the question was initially about hormone replacement therapy in unaffected patients that are in menopause to really control menopausal symptoms. But, and I agree with everything that Sue said, the other component is for those that are undergoing bilateral sublinguophorectomy, removing their ovaries at a young age, and going into early menopause because of a BRCA gene or POP2 gene or primary ovarian cancer. For those patients that were causing early menopause, the issue is a little different, and for those, we're actually, allowing and encouraging use of hormone replacement therapy until they get to the normal age of menopause. So for those, it's also safe to be on hormones. And then the triple negative survivors is also a little different when it comes to replacement, but as a blank statement for unaffected postmenopausal women trying to just, stay on estrogen and be happy on them, times have changed and we no longer encourage that, or at least not for a long time.
Obviously, we could be here forever, and these are incredible questions, and I will say a couple of things. Hopefully everyone has a primary and a gynecologist, whoever it may be. Write all your questions down. I know when you get in front of the doctor, you don't remember. Write them all down and ask every question. You are paying a copay. You are paying insurance. Your health is everything. You have to be your own advocate. You really do. You have to know your body. And also, pretty much a lot of answers are in this book. So we urge you to get a copy of Experts in Pink. Thank you to our amazing physicians. Really, thank you. Thank you to Cindy and Sabrina for putting this together. Thank you to all of you for being here this evening. And we are those two girls in the morning and the evening, and hopefully you'll listen to us in the morning on 101.5 Light FM.